Hi Rehabbers, welcome back to the channel. It's Kevin. This week's learning is all about the metabolic factors that could possibly contribute to the development of tendinopathy, in particular rotator cuff tendinopathy. The aims of this are to know what metabolic syndrome is and how it's diagnosed, understand how this can affect tendon health, understand the association between metabolic syndrome and tendon pathology, in particular to the shoulder, and how metabolic conditions can affect rehabilitation programs. So as we become more and more sedentary with poorer diet and physical fitness, we are more at risk of developing the components of metabolic syndrome, so diabetes, hypercholesterolemia, high BMI, and high blood pressure, and all of this can increase the risks of developing tendon problems. So the metabolic syndrome is an umbrella term which encompasses several health conditions. There are multiple diagnostic criteria depending on where you look. The criteria I was using was from the BMJ best practice, and basically this is diabetes, high glucose, high BMI, obesity, high cholesterol, high triglycerides, hypertension can all be considered key parts of metabolic syndrome. So this is a nice study from Lay et al. 2024, and they show the effects of metabolic syndrome on tendons themselves. So with diabetes, there is a buildup of AGEs, or advanced glycation end products, which can affect the tendon capacity, load capacity, healing, and reduce stiffness. Obesity can release chemicals that can actually increase the risk of tendon injury, while hyperlipidemia and hypertension can both affect the blood supply to the tendon, causing ischemia, with the cholesterol also could affect the actual tendons themselves. So this is a little bit more in detail. So with hypercholesterolemia and adiposity, or increased fat. So the first one is obviously the high BMI causing a higher load, but this isn't the whole story. Evidence suggests that patients with a higher BMI have a higher risk of shoulder pain. So if it was purely load, then this wouldn't make sense. So another possibility is an inflammatory component. As we know, and as I've already mentioned, adipose tissue isn't just fat storage, it is involved with pro-inflammatory cytokines, which can create a low-grade inflammatory state, which can obviously affect things. Well, as we said, the high cholesterol triglycerides can infiltrate the tendon matrix, physically disrupting the collagen and then causing problems. One of the key things with metabolic syndrome for diabetes is the HbA1c levels and their possible predictive role in tendinopathy. Patients with elevated HbA1c, even in the pre-diabetic range, had been shown to have a 3 times higher risk of tendon injury in the lower extremities compared to individuals with normal levels. Patients with higher cholesterol also had an increased risk of tendon injury in the upper extremities by 1.5 times, and individuals with metabolic syndrome had 2.5 times higher risk of tendon injuries in both upper and lower extremities. So this is a nice little summary slide of the effects of diabetes on rotator cuff tendinopathy. Basically, the studies show, Ranger et al. Has shown that patients that are diabetic have 3.67 times the odds of developing tendinopathy compared to non-diabetics. Also, other studies by Leon has shown that diabetics have a 2.24 times the odds of developing it. This is shown as well with Geary et al., who showed a 1.49 times the odds, and Su et al. Again showed 1.276 times the odds of developing tendon problems in the cuff compared to non-diabetics. So overall, with this conclusion, there appears to be an association between diabetes and rotator cuff tendinopathy, with the literature suggesting between 1.276 to 3.67 times the odds of developing cuff tendinopathy compared to non-diabetics. The evidence also suggests that patients that do develop tendinopathy, they have generally been diagnosed with diabetes for around 5 to 8 years, compared to those diabetics that haven't developed. And similar with the cholesterol and triglycerides. So this study by Skovgaards in 2020 shows that patients with higher cholesterol have 2.05 times the odds of developing upper limb tendinopathies than patients with normal cholesterol. This is a nice overall slide from Tilley and colleagues in 2015. And this shows here, so the total cholesterol. Basically, we want the cholesterol to be basically anything above 5.3 will increase the risk massively. So we want it as low as possible and preferably under 4.7. The HDL-C we want between 1.48 to 1.83. Anything less than 1.48 increases the risk of pain intensity being higher. The LDL-C we want to be under 2.5, while the total triglycerides we want between basically under 1.08. So take-home messages that I use for my tendon patients. So in addition to patient education, physiotherapy, tendon rehab, my tendon programs also include screening of the metabolic markers such as HbA1c, cholesterol, LDL-C, TC, TG, blood pressure, BMI, and liaising with our medical colleagues to keep these within range if possible. Also aiming to lose 10% body weight and optimize BMI. And the really key thing here is tendon loading is massively important. It still is the main thing that we use, but the loading dosage must be controlled. We need local healing and systemic health. So what I use with my patients, if HbA1c is really high or it spikes, then I will decrease the force production or rate of force development, those high power exercises for tendons and no plyometrics. Trying to look at healthy diet, smoking cessation, physical activity with regards to walking, starting slow and building up. And I always generally have a lower progress for my patients with metabolic syndrome, so I try not to go too far too quick. So in conclusion, metabolic syndrome has a strong association with rotator cuff tendinopathy. I feel it is useful to include metabolic screening with your tendon patients, and hopefully I've shown how metabolic syndrome can change your rehab plans. So I hope you like this talk. If you did, please like and subscribe, and see you next time.